Hi, I'm Katie Mahoney, Vice President of Health Policy at the U.S. Chamber of Commerce. It's my pleasure to talk with you today about the value of the employer-sponsored coverage system and the benefit that it provides to employees, healthcare providers, communities, and businesses alike. The Chamber is part of a coalition called Protecting Americans Coverage Together, which was created 2 years ago to highlight the strength of the employer-sponsored insurance system, or ESI. ESI is the backbone of the American healthcare system, covering over 150 million Americans. The business community in general, and the Chamber in particular, have been staunch supporters and defenders of this private coverage through the years. PACT has recently released some incredible new data from an independent study that examines the return on investment that employers see from their employee health benefits programs. Before we get into the data, I'd like to share where we started and why this is so important. To hone our efforts to protect the employer-sponsored system, in August of 2020, the Chamber launched a campaign against proposals to expand Medicare eligibility. We commissioned a report from Alex Brill to assess the harms such a proposal would inflict on workers, healthcare providers, taxpayers, and consumers. And here's what we found. Workers would likely need to pay for additional supplemental insurance. Healthcare providers will be negatively impacted because Medicare pays significantly less than private insurance does. And expanding Medicare would cost taxpayers trillions of dollars. What's more, the number of uninsured individuals would decrease only slightly by 0.2%, while premiums would increase between 2 and 10% for people who remain in the individual market. In the spring of 2021, the campaign grew into a broader business coalition, with the Business Roundtable, the Council for Affordable Health Coverage, the National Association of Manufacturers, and Vermeer Corporation joining the campaign. Before the pandemic, it was broadly apparent that ESI was good for employees. 45% of people named health insurance as their most valued benefit in terms of their job satisfaction. 86% of those with ESI were satisfied with their insurance, and that has increased. We know that workers benefit significantly from it, and we know that employers understand that it is important to provide their workers with quality health care and that this system provides the best outcomes. Numerous surveys from Forbes to SHRM to Inc. to Kaiser Family Foundation to Glassdoor, Institutional Investor, and MetLife provide strong statistics. Just last week, the Locus Group released results from a new survey conducted in June of 2022, which found that 87% of individuals say that coverage is increasingly important in accepting their current job, and 84% say that coverage is increasingly important in staying at their current job. But there's less data on what all this means for employers' bottom line. In fact, some folks have questioned whether ESI is beneficial for businesses. Sure, it may be something employers feel obligated to provide, but is it worth it? To assess this, we asked Avalere to look at the costs that businesses incur in providing coverage and compare those to the financial benefits they receive. Investment in ESI includes health insurance premiums, wellness programs, direct medical expenses, administrative costs associated with processing medical claims, and other costs associated with providing health insurance. And guess what? The Avalere study found that providing ESI is in the financial interest of American employers, significantly so. There's no question that the private sector provides a higher quality of coverage than a government plan, with the average employer paying more than 70 to 80% of the cost of coverage. What this report shows is that the quality of benefits can drive both return on investment and a healthier workforce. The top line takeaway is that on average, employers see a 47% return on investment for their ESI program in 2022. That means for every dollar they spend on ESI, they get $1.47 back. These are direct costs and direct benefits, and the number goes up in the 5-year window of this study. By 2026, the return on investment is 52%. Really huge numbers. Avalere broke the benefits down into 6 buckets: direct medical costs, productivity, recruitment, retention, short and long-term disability, and tax benefits. The largest return comes from productivity. That's reduced absenteeism and presenteeism. Savings in direct medical costs are also a big driver of the return on investment, along with, of course, the tax benefit received. Recruitment, retention, and disability costs are also important, but provide a relatively smaller portion of the return on investment. This report shows that the quality of benefits can drive both return on investment and a healthier workforce. For example, Avalere found that the wellness programs that are so often included in group health plans are a significant driver of lower medical costs and thus lower medical spend. Similarly, the report shows that in general, the more employers invest in their benefits, the more return they actually see. We know employees place a high value on quality health insurance in the workplace, and now we have evidence that employers benefit significantly from investing in these programs as well. Employer-provided coverage is the backbone of the American healthcare system, and this report reinforces that any reforms should build off this model that is good for workers and companies alike. The report has much more detail, and I encourage you to take a look at it closely. But the key takeaway is that ESI is a win for employees and employers alike. To provide a case study of sorts, we are thrilled to feature a leader from one of our PACT Coalition member organizations, Teresa Havel, Benefits Manager at Vermeer Corporation, a manufacturer of industrial and agricultural equipment headquartered in Iowa. Teresa has been with Vermeer Corporation for 25 years and is responsible for its employees' core benefit package, medical leave, on-site clinic and pharmacy, on-site health and well-being program, and the chaplaincy program. With her focus on providing a comprehensive benefit suite to team members, which allows team members and their families to live their best and healthiest lives, she is an ideal leader to speak to the value of ESI.
Katie, thank you for allowing me this opportunity to share the Vermeer story. Vermeer Corporation was founded in 1948 by Gary Vermeer, and for the past 74 years, our team members have rolled up their sleeves to build the best agricultural and industrial equipment for people to do the important work around the world. Taking care of our people is our priority. Based in our 4P philosophy of principles, people, product, and profit, caring support is foundational to who we are and part of our day to day operations. From benefits to wellness resources, our team members and their families have confidence that there is a whole system of support behind them. Like most employers, we offer benefit opportunities so our team can be happy inside the workplace and outside of the workplace. We can be agile and with design and cost strategies by partnering with our carriers, our providers, and other organizations, designing our programs to provide access to quality, affordable care. Knowing our people and the communities they live in is key to being able to do this. We are also able to help them navigate the very complex world of healthcare. They work with people they know and know the people they work with. Access to care can be an issue in many rural communities, with patients waiting weeks to be seen by their primary care providers. Some also avoid necessary preventative and maintenance care because of cost. To ensure that cost and access are not barriers to our team members, we introduced an on site primary care clinic in 2002. The clinic serves our team members and their eligible dependents, providing care and lab services. Because the clinic is exclusive to Vermeer, more than 90% of the appointments are made in the same day, and the average appointment time is 20 minutes from the time they register to the time they leave. What is the cost? It is free for most of our employees, and our high deductible health plan members only pay the cost of the visit, which is actually less than half of what they would pay if they went to a community provider. Both Vermeer and our team members save time and money and are still getting the care that they need. In 2007, we added an on site pharmacy that serves our team members nationwide. Through our partner Premise Health, we negotiate lower prices for our team members on medications and over the counter products. Our health plan is designed to incent people by offering lower co-payments for those who use our pharmacy. And then we pass those savings on to our team members and their families. Again, as an exclusive pharmacy only for Vermeer and our retirees, we offer lower cost, better service, and personalized care. Our pharmacists know our people and can talk about what is happening in their lives and help guide them to the appropriate resources. They educate and advocate for the employee, communicating with providers and our carriers to assist with questions and issues. Chronic disease is the healthcare issue we all must battle. Two healthcare coaches on our campus help our team members and their families to walk the journey to better health. They can customize programs and care paths to meet the patient where they are. They can coordinate care with our clinic and the dedicated chronic care management provider we have on staff. They can connect the patients with our pharmacy to ensure they are adherent with their medication programs. And they also work with our community providers to ensure the continuity of care for our team members. The pandemic brought a lot of changes to a lot of things: how we work, how we interact, and how we get healthcare. Providing options for our team members to access virtual care has been very important. By working with our health insurance carrier and our clinic, we have been able to offer low cost or free virtual options for both physical and behavioral health. With the forward thinking of our insurance carrier, we continue to discuss the opportunities to expand these services to our team, providing better and faster care when they need it. Taking care of people physically is important, but if we don't take care of their brain health, it leaves a huge gap. We offer a traditional EAP service, providing limited free counseling services, but more importantly, we have chaplains in each one of our facilities, offering immediate care for those with simple day to day stressors or others who have more severe situations. Modeled after the military chaplaincy program, they can walk the team member or their family through the day to day while connecting them with resources necessary to care for them long term. They can connect them with, sorry, they are connected to our communities, knowing the resources and providing and sharing resources into the community. These are key pieces of taking care of our team. As a self funded employer, we have flexibility to provide what our team needs and to help them. Navigating the world of healthcare or any other benefit can be quite confusing. Whether you're speaking to your provider, to their administrators, or to your insurance company, it can be overwhelming. And when it is overwhelming, we can be the liaison between the member and the carrier. We can help them know what to ask, how to ask it, and give them guidance. A friendly voice that you can relate to means a lot, even if it is just an ear with no time limits. Caring, it means more than anything to our team members. We can educate our team on the cost of healthcare, providing incentive to make healthy decisions with our wellness program, providing low cost or free options with our virtual and on site services, and helping them understand good stewardship of the healthcare resources we are blessed with in the United States. I could spend a lot of time talking about why offering a benefits program is beneficial and rewarding to us as an organization. It is an attraction tool and a retention tool, bringing people to us and keeping them with us. How we care for our families is a highlight of why we are an employer of choice. It motivates people to do their best work, knowing that the organization they work for is willing to invest in them. It is a demonstration of a caring culture and our 4P philosophy.
Thank you so much, Teresa. What a tremendous case study that you were able to provide about Vermeer and the suite of benefits that it offers to its 3,500 employees in the United States. It is a pleasure to be here with our colleagues at the Business Roundtable, the National Association of Manufacturers, and the Council for Affordable Health Coverage. These three trade associations that are based here in Washington, D.C., that lobby and advocate on behalf of businesses every day are terrific partners with the U.S. Chamber and joined us just a year ago as we launched the campaign of PACT, Protecting Americans' Coverage Together, as a broad business campaign. The COVID crisis has shown the resilience of the employer-provided coverage In 2020, the number of people with employer-sponsored coverage fell only 1 to 2%, despite unemployment rates peaking at more than 14%. So now more than ever, we know the value of the employer-sponsored system, not only to employees, but also to employers. The Business Roundtable is an association of chief executive officers of America's leading companies. These CEOs lead companies with more than 20 million employees. I'd now like to introduce Corey Astle from the Business Roundtable. Corey has been at the Business Roundtable as the Vice President of Health and Retirement Policy for 4 years and is a tremendous colleague that we work hand in glove with on many issues, but most importantly, the value of the employer-sponsored system. Corey?
Thank you, Katie. I appreciate the opportunity to participate in this important roundtable focused on employer-sponsored insurance and the role that it plays in protecting the health of American workers. As you mentioned, Business Roundtable collectively leads companies with more than 20 million employees. Business Roundtable includes the world's largest employers, so we have significant insight into the challenges and opportunities facing employer-sponsored insurance. Our members are committed to making sure our employees and their families have access to affordable, quality health care. Employer-sponsored insurance is the backbone of American healthcare system, with nearly 156 million, or almost 50% of Americans obtaining their healthcare coverage through their employer. Employer-sponsored insurance works because employers are committed to providing affordable and comprehensive benefits that enable employees and their families to access the prevention and healthcare services they need. Employer-sponsored insurance offers tremendous value. First, coverage is affordable. On average, employers cover 83% of premium costs for single coverage and 73% of premium costs for family coverage. In addition, private for-profit firms have lower annual premiums for family coverage than do public employers. Coverage is stable. The average percentage paid for premiums by employees has remained consistent over the years at around 17% for single coverage and 28% for family coverage. Employees have choices. 74% of covered workers in large firms are employed by a firm that offers more than one type of plan. Plan choices range from a broad network plan with high monthly premium and a low deductible to a narrow network plan with a low monthly premium and a high deductible. Coverage is generous. 94% of covered workers at large firms had coverage for specialty drugs like expensive cancer drugs. More than 90% received financial assistance for mental health services. Importantly, employees are happy with their coverage. 90% of adults who receive health insurance through their employer or their spouse's employer are satisfied with their plan, according to polls. 80% of respondents would choose a job with benefits, even if an identical job offered 30% more salary but no benefits. Employees are also healthier and more productive. The recently released Avalere study shows that employer-sponsored insurance has a return on investment of more than $275 billion in increased productivity due to better outcomes and happier workers. Finally, employers who sponsor health insurance can be engines of innovation in healthcare, trying out new ways to deliver quality, affordable care in the most cost-efficient way. Unlike the relatively slow process of pushing change through regulation and government-funded programs, employers have demonstrated the capacity to rapidly adopt innovation in their plan designs, in selecting providers, and in adopting new technologies. Employers have a host of new solutions available to them, from delivering care digitally to using analytics to drive better care for their employees. Employers are embracing new care delivery models that support improved wellness, preventive care, behavioral health, and chronic disease management. Employers are leaders in seeking transparency of cost and quality information for their employees to help in the selection of the right choice of care, which in turn produces better outcomes and lowers costs. Employers also help address equity through the design and structure of their benefits and other employee services, including encouraging relationships with primary care providers and partnerships with community-based organizations to connect underserved populations to a reliable source of care. Employers are working to improve their healthcare offerings to improve access, delivery, and quality for all Americans in the communities they serve. Further, there is no better example of the innovative flexibility in employer-sponsored insurance than the ability of companies to proactively respond and improve health coverage for their employees during the COVID-19 pandemic. According to a recent Kaiser Family Foundation study, nearly 65% of large employers made changes to their telemedicine benefits. Another 40% made changes to their mental health benefits to meet the needs of their employees during the pandemic. In short, employer-sponsored insurance works, but we know there are still challenges that employees face in using their employer-sponsored insurance and getting access to the care they need. Healthcare costs continue to be an issue. And employers know changes need to be made to ensure the employer-sponsored system is sustainable and affordable in the long run for our employees. Employers are working to diversify their offerings to increase choice, improve affordability, and provide benefits for their employees want. This includes making health savings accounts work better for their employees. It includes increasing access to wellness and prevention services, coverage of telehealth, offering more mental health services, adding on-site clinics, covering new services such as enhanced cancer benefits, and of course, addressing the social determinants of health. Employers are exploring new partnerships to improve outcomes and address affordability for their employees through centers of excellence, through direct primary care, lower cost sharing tied to high quality providers, and empowering employees to purchase more affordable plans that only include the providers and benefits their family needs. Despite the ongoing successes and continued efforts to improve employer-sponsored insurance, the system is under attack from proponents of a government-run health care system. These proponents want to eliminate the role played by employers, health plans, and the tax code in ensuring employees have choices and access to affordable, generous, high-quality health insurance. Employers should be given the opportunity to determine what works and what doesn't, instead of the government mandating what innovations are best. The continuation of a flexible market-based federal framework that does not include mandated benefits or price controls helps employers innovate and keeps employees' health coverage affordable by allowing employers to use economies of scale and develop best practices. Business Roundtable stands ready to work with Congress on ways to strengthen employer-sponsored insurance and reduce healthcare costs for our employees rather than undermine what's working. Thank you for the opportunity to participate today. Business Roundtable will continue to stand steadfast in our support for the private market, for employer-sponsored insurance, and for what we believe is in the best interest of our member companies and our 20 million employees. Thank you.
Thank you, Corey. To underscore your points about affordable, stable, generous, innovative, and diversified benefits, I commend you for your remarks in terms of the value of the employer-sponsored system and the importance of it. It is now my pleasure to welcome Robin Burstling from the National Association of Manufacturers. The NAM works for the success of more than 12.8 million men and women who make things in America. Robin?
Thank you, Katie and Corey. There is little daylight between our organizations. We work so well together to advance such an important cause on behalf of American businesses and workers. And I'm just going to start right there. 99% of NAM member companies offer health benefits to attract and retain talent, to maintain a healthy workforce, and because they believe it is the right thing to do for their employees. Manufacturers develop and lead private sector solutions to offer benefits that are more flexible, innovative, efficient, and attractive to employees, more so than what the federal government is prepared to offer the public. This is such a big deal to us. It's a big commitment, and we are so serious on behalf of employers. This is a significant source of coverage for working Americans and exceedingly popular as a benefit. We are pleased that the Chamber and Protecting America's Coverage Together have united to offer critically important information and data that there is a return on healthcare investments, and it's a substantial return. For every dollar spent, there is $1.47 in return. Manufacturers have known anecdotally that employee investments in health benefits lead to happier, healthier, and more productive employees, but we did not know all these details until this recent finding, and that the return on investment is truly significant. Manufacturers have a very strong sense of community and stewardship and want to take care of their employees. Vermeer is a great example of a company that lives that value. So manufacturers go to great lengths to provide health insurance offerings to employees, and our industry is at the center of many life-changing, life-saving health innovations that are either being researched or coming to market. We've certainly learned that firsthand from ongoing vaccination efforts and pandemic response efforts. So when we think about the healthcare landscape, we certainly have three core principles. Manufacturers believe that the values that have made America exceptional, free enterprise, competitiveness, individual liberty, and equal opportunity, must guide any process to simplify healthcare and achieve lower medical costs. Effective solutions will require reasonable, market-oriented approaches. The public and private sectors should work in collaboration to lower costs, address chronic conditions that pose serious public health risks, and reduce ongoing access challenges for the uninsured. Drawing on the expertise of the private sector, the government should recognize that employers have a very deep commitment and a strong incentive to design healthcare plans that improve outcomes while increasing the value and quality of the coverage provided. Second, there's a medical credo. First, do no harm. We really need to guide healthcare policy efforts with that particular philosophy in mind. If something is working, let's not break it. Third, the innovation ecosystem found in the United States is unique and part of what makes our nation a world leader in research and development. Our medical innovations, pharmaceuticals, and medical devices in particular, are possible because of a policy environment and business environment that enables unparalleled investments, research and manufacturing here in the US. Advances in medical innovation require major upfront private sector investments, far beyond what any government alone can provide. We have to maintain a welcome business environment so that we improve innovation and continue to grow. Despite the so many challenges that we face in healthcare and the strains that are facing the healthcare system, we are a nation that prides itself on first-class, best in the world medical care. I think the study really amplifies all the wonderful findings and things that we've been talking about related to employer-sponsored coverage. So I want to thank the Chamber for including the NAM and VRT for sharing some similar goals that we've worked well together on. And thank you again.
Thank you, Robin. Our final speaker for this event is Joel White, who is president of the Council for Affordable Health Coverage, a broad-based advocacy alliance. The CAHC supports competitive insurance and provider markets, more choices for consumers to meet their healthcare needs, lower medical costs in hospitals and physician offices, employer and plan flexibility, and incentives to keep people healthy. It is my pleasure to turn it over to Joel.
Thank you, Katie. Appreciate it, and appreciate the comments from Corey and Robin. I wanted to talk a little bit about employer coverage and some of the changes that we've seen during the pandemic. I think that it's, there we go. So I have a few slides to share and wanted to walk through a little bit of data that we've compiled from different sources, including our own polling and research that shows the value of employer coverage and why it's so important to protect it from ongoing threats from Congress and the Biden administration. So first, I think if this is from our polling, what we've seen is that voters generally have coverage and they're very satisfied with it. So right now, 91% of all Americans have some form of coverage. Most of those have coverage through their employer, whether it's an employer plan or a union-based plan, 46% in our survey, and 25% have Medicare, and then the rest have other coverage like Medicaid or CHIP or TRICARE. But 82% are satisfied with the coverage they have, including their job-based plan. And that's stratospheric. Whenever we see a number above 70%, we know that people are really, really happy. 82% is very happy. Secondly, I think it's important to know where we get our coverage. And right now, as I mentioned, about 91% of the population has coverage, just 8.6% lack coverage. That population is uninsured for a number of different reasons, including some opting out of the system because they don't see value in self-insuring. Others don't have access to Medicaid, but 10 million people basically lack access to a subsidized plan. But most people, again, 91%, have coverage, and most of those people have coverage through their employer-based system. And it's important, as Katie mentioned, through the pandemic, what we saw was that less than 1% of people lost access to their employment-sponsored coverage, even though we had 14% unemployment rate. So these people lost their jobs, but they quickly found other jobs or found other ways to maintain their employer-sponsored insurance, including through COBRA. But we also saw a big uptick in Medicaid enrollment and some in CHIP. But they get their coverage generally through employment-sponsored insurance, including dependents and spouses. About 180 million people benefit from this system. And as a result, because they like it and most people get it through their job, they don't want fundamental changes to the system. Again, this is our polling data, and you can see overall the majority does not want to have fundamental change, 40%. 51% want to make improvements, gradual improvements. And you can see the kind of breakdown there across parties. And these improvements include improving their insurance. And the one thing that we see consistently across demographics is that most people want their insurance to work better for them. Lower out-of-pocket costs, lower premiums are the number one issues, and that means we need to make coverage more affordable. Unfortunately, I think Congress and the Biden administration are taking proactive steps to make employer-sponsored insurance less attractive. And they're doing this through a number of policy mechanisms. I've listed a few on this slide here. First is the family glitch. I think all employers want to fix the family glitch, but we want it done in the right way. And the way the Biden administration has proposed fixing it by changing the definition of eligibility for subsidies from self to family coverage would cause about 1 million people to lose their job-based coverage. That's a bad thing. We want to fix the family glitch without weakening what people already have. Build Back Better, millions of people would lose coverage as a result of that legislation as Affordable Care Act plans become much more attractive compared to employer coverage. In addition, weakening the affordability and employer firewall included in the law would cause more people to go from employer coverage to Obamacare coverage. And then a thing that Corey alluded to, I think, efforts to expand government in healthcare, including the public option and single payer, would result in a massive transformation of our healthcare system, which voters don't want. But it would also result in millions of people losing their coverage. So single payer would be a complete replacement. 180 million people would lose their job-based plan. Public option, for every 10 people who sign up, 6 would lose what they have. And I think that's important in the context of the study that came out that shows that employers are not only offering coverage as a benefit to workers, they're using it as a strategy to attract and retain talent in a very tight labor market. And that's producing a benefit for employers. So they're, for every dollar invested, employers are seeing a $1.5 return on their investment. That's through better rates of showing up for work and reduced absenteeism, better wellness, including better productivity. And so those are aspects of employer-sponsored coverage that most government programs don't do very well. They don't focus on prevention. They don't focus on wellness. And that's something that employers have really stepped up their game around. Unfortunately, as costs have increased, they've really impacted the ability of businesses to continue to afford to provide coverage for their workers. These are an estimate of health insurance offer rates by size of firm. And we really focused on the small firm here. You can see the different lines. Top line is less than 50 workers, all the way down to the bottom of the blue line of 1 to 4 workers. And what we see over time into 2031 is that more and more people are losing access to coverage through their business. And the reason for that primarily is they're unaffordable. So health costs are going up unsustainably. For small businesses, they were partially or completely shut down by COVID. They're facing high inflationary pressures for all of their inputs, but including health coverage costs. And for the small guy who's unable to negotiate lower rates, they find it harder to find a good deal that works for both them and their employees. So one of the things that's been a strategy that we're seeing in the small group market is that more employees are going into the ACA exchanges, Obamacare, and they're going into Medicaid, where they face higher deductibles, higher premiums, and less access to doctors and drugs. That's a bad deal for them because we know our small business members want to provide coverage. They want to provide a benefit to their employees. They use it as a strategy to attract and retain talent, but they're finding it increasingly difficult to do so. And the biggest reason you'll see here, this is polling data from Kaiser from 2019, but the numbers haven't changed much over time. In fact, they've gotten a little bit worse. The number one reason is that coverage is not affordable. 74% of people say, I can't afford to provide it because the coverage simply isn't affordable. So developing strategies to support employment-based coverage is really important. And this goes back to the polling that we did of voters. There is strong support across parties for expanding job-based coverage. And you can see some of the solutions here, making out-of-pocket costs tax deductibles. These are HSA and HRA strategies, 79% support there, which is, again, stratospheric. Using tax credits to lower deductibles, reduce those out-of-pocket costs. Again, 74% support. Using tax credits to expand coverage. Again, 40% of all enrollees in the Affordable Care Act are from small businesses. And there's no easy way or easy path to get them back into small business coverage where their deductibles and premiums would be lower. So creating a tax credit for a small business to expand their coverage has broad-based support. And then providing a credit or a win bonus when employees leave that plan and join the small business plan, again, with significant support. So the voters support these initiatives. And I think what we've seen with members of Congress, as we've talked to them and as we talked to the Biden administration, they want to support and help small businesses in particular. They know that they're facing these crushing costs caused by inflation and COVID lockdowns. So the agenda that we've helped develop includes tax credits for small businesses and their workers to help better afford their coverage, a small business reinsurance pool to lower premiums for all people in the small group market, using the same tools that large businesses use in the small group market for small employers would level the playing field and allow them to access things like level funded plans or reinsurance that helps them chop that high cost claim out of their risk pool and afford lower premiums. Expanding choice of plans, including new HSAs for gig workers. There's at least 4 million gig workers just in the state of California. These are folks who are working for Walmart as a greeter in the morning and maybe driving an Uber in the afternoon and then doing DoorDash at night. They have multiple part-time jobs. They don't have access to full-time medical benefits. We want to create a structure where employers can contribute to an HSA for that worker so that they can purchase a major medical policy and take advantage of those lower costs and out-of-pocket costs and premiums. And then finally, I think we oppose weakening private job-based coverage, and therefore we oppose single payer and the public option and all the damage that would cause for 180 million Americans who get their coverage through job-based care. We're very excited that Congress is liking these proposals. They're actively on the agenda. We're pursuing support for them and generating additional visibility around them. Working with people like the Chamber and NAM and Business Roundtable, we're really excited about protecting job-based coverage, but also expanding it so more people can benefit from the coverage that employers provide.
Corey, Robin, Joel, thank you so much for joining us today and for your ongoing partnership in general, but with regard to PACT in particular. I wanted to just highlight for our audience a few closing statistics. Our organizations represent hundreds of thousands of businesses across the globe, as well as offer jobs for millions of employees. That is really important to the businesses that we represent and to the work that we do every day here in Washington, D.C. And of the 150 to 180 million Americans that have employer-sponsored coverage, we will continue to tout the value that it provides. Again, we know that employees value employer-sponsored coverage, with 87% saying that it is increasingly important for them as they accept a job, and 84% saying it is increasingly important in their decision to stay at their current job. So we will continue to fight for the employer-sponsored system. Not only is it important to employees, but it's valuable to employers. As this report shows that was released from Avalier, commissioned by PACT, the return on investment to employers is significant, with a 47% return on investment. Thank you very much, and stay tuned as we continue to fight for the employer-sponsored system.